Okay, Derek, so my first question, there is the hope that Ontario is finally emerging from the COVID-19 pandemic. It finally looks like we're getting out of the last 2 years that have been rather rough for everybody. What is your party's primary focus going to be to help Ontarians come out of what will hopefully become an endemic and move forward from there?
I think you're right. I think one of the biggest casualties in the last couple of years has been the division in the province. So we want to make it clear to people who are voting that our party will not be locking down the province again. We're not going to be imposing invasive mandates or imposing on people's medical privacy. We want to be clear that we want to be rebuilding the province. So what that means is addressing the bankruptcies that have occurred due to the lockdowns, addressing mental health issues that have occurred, bringing our children back up to speed. A lot of kids have lost something during these last 2 years in terms of school closures and education. We need to make sure that we bring our province back to where it was before. So you're not going to see any more destructive policies out of our party or our government.
So let's say the situation is that we've heard that there may be another wave coming this fall. Let's say that's the scenario. What will your party do then should that go the other way and Ontarians are going to need help again with a seventh wave?
Sure.
About to happen?
I think it's fairly simple. There was a lot of very smart people in the pandemic who disagreed with what the government was doing. And what we believe and what many other smart doctors believe is that you need to have focused protection. If you're sick, stay home. If you're part of a vulnerable group, there can be focused protection. The elderly, people with immunocompromisation. What we're not going to do is tell the healthy to stay home, close down businesses for the sake of it. So is there a need for focused protection? Is there a need for looking at various other ways to treat COVID-19 or any other pandemic? There absolutely is. But the blanket restrictions, the blanket lockdowns, that's what our party's against.
First question is, Ontario is hopefully continuing to emerge from the COVID-19 pandemic that's gripped our country for 2 years. So what is your party's primary focus going to be to help Ontarians to come out of COVID and move forward?
Well, to help come out of COVID, COVID's not over yet. I mean, we're in a stage now where there could be more variants that come out. They could be less virulent. The Omicron one is fortunately not as virulent as previous strains, although it seems to be a lot more easily spread. So more people are getting it, but they're not as seriously affected, generally speaking, although there are still people that are dying of COVID. So it's not over yet. It's becoming an endemic thing. We're all used to mask wearing indoors now. We're all used to things, and we should continue with those things. To help emerge from the pandemic, to help emerge economically, I think it's important that we help small business, that we have the kind of supports and incentives that small business needs to go ahead. Big box stores were favored by the Ford government, and they were able to stay open, and they made a lot of money during the pandemic. But small business really suffered, and that's where we have to put our support and where we would have programs that would help support small business.
And what specifically would those programs be to help small businesses and help them kind of get through and, not have to worry about having to shut down again, although I don't think, I don't think there'll be any more shutdowns, but just, what are you looking to put in place for those?
Yes. And for small business, these are a rebate for local tourism, for example, that would help for people that travel in their own areas, in their own communities. We would do that kind of a rebate program so families can get money back if they play, eat, and stay in their local areas. So it's this kind of a program that we would need. So we need to, have these kind of supports, loans, incentive programs for people to reopen and get back on their feet.
Ontario is hopefully continuing to emerge from the COVID pandemic. What is your party's primary focus going to be to help Ontarians come out of the COVID and to move forward?
The very first thing the New Blue Party is going to do is get rid of all of the COVID mandates. They need to be all lifted so that Ontario can open up. They're also going to increase early access to any kind of COVID treatment that hasn't happened in the past. so that people can recover more quickly and get on with their lives.
Okay. Can you explain what you mean by early access to treatment?
There are treatments out there that can be used that haven't been used in the past year and a half, 2 years. And we need to open that up so that people have the access to those things. We have had a bit of a history where certain medications or treatments have been held back. And that's not necessarily the way it should be. So that part of medicine will be opened up to people so they have a choice of early access. In the past, by the time people got to the hospital setting, they were pretty sick.
Okay. So that answers the question in terms of dealing with people who have COVID or may get COVID. Right. What about in terms of society moving forward, businesses moving forward, people getting back on their feet? What are your plans to sort of help from that perspective?
The plan is to rehire the staff that were let go because of medical mandates, if they so choose. We all talk about the healthcare people, but there's lots of people out there that, due to the fact that they refuse to disclose medical information, whether they got the shots or whether they didn't, were on a long-term layoff or they were let go. These are talented, seasoned people who could probably be amazing mentors to the newer ones coming up. They need to be offered that ability to come back to work. We need to let the businesses know that they can be open for business and not run the risk of being locked down again with the Reopen Ontario Act. That act will be eliminated from any portfolios. And there's decreases in HST with the New Blue Party by 3%. That doesn't sound like much, except 3% off everything you purchase can certainly help, and eliminate the provincial carbon tax, which will help fuel prices. So by doing that, you're actually going to be helping to decrease the ever-increasing price of food and goods, and that will help the province begin to move forward.
Ontario is hopefully continuing to emerge from the COVID-19 pandemic. What is your party's primary focus going to be to help Ontarians to come out of COVID and move forward?
Absolutely. It is incredibly important that as we come out of COVID, we stay open. For our economic benefit, for our mental health benefit. As the spring and summer arrives, we all want to be out, enjoying our communities, enjoying the wonderful areas that we have throughout Hastings, Lennox, and Addington. And it's incredibly important that we manage to stay open. And to that end, this government is putting all kinds of efforts into increasing the health services, increasing the capacity of our health services to ensure that no matter what, moving forward, we can stay open and we can face anything that comes down the path.
So economy and health would be the focus?
As to how to keep coming out of COVID, absolutely.
You mentioned mental health as well when you gave your list. Do you plan to do anything to reduce wait lists to help people get the services that they so desperately need right now?
And as we move forward, improving our overall healthcare system, bringing in more staff, training more people within those fields is an incredibly important part. We're building new hospitals, building new long-term care beds, and all of this is to relieve that pressure, to relieve the wait list, both for mental and physical health situations for everyone.
Question number 1, Ontario is hopefully continuing to emerge from the COVID pandemic. What is your party's primary focus going to be to help Ontarians who come out of COVID and move forward?
Well, what I see as the primary focus is recovery. So we need to recover. And a large part of that's going to be to deal with the number of healthcare workers, education workers, and others that have left the sector. So we need to rebuild. We need to make sure that people understand that we're back on track. We're ready to go, but we need to pay a lot of attention to recovery and making sure we're dealing with workers that, quite frankly, have been burnt out.
How do we stimulate people's interest in getting back into that area? I mean, 2.5 years of dealing with COVID has produced a lot of stress, a lot of burnout. People have had to take sick leave. So it hasn't been a glamorous profession. It's been an essential one, and we have greatly appreciated the work they've done on the front care and healthcare. But how do we overcome what is now a knowledge that they could face this going forward to make people interested in the healthcare sector?
So, first of all, respect. A deep, profound respect and appreciation for the great work that our healthcare, education, other public sector workers have done. But part of that, the most important thing, is the unbelievable legislation that was passed, Bill 124, that suppressed wages of healthcare workers. I mean, this was a huge insult to our healthcare workers. So I'll go back to starting with respect. I think we need to acknowledge that these are everyday heroes, that the work that our healthcare professionals have done in this pandemic and all the time. I mean, whether it's, in the middle of the night dealing with a trauma case or a cancer case or a child with some, issue, our healthcare workers have always been there for us, as have our teachers who struggle in the classroom every day to deliver the best possible services under difficult circumstances, and other public sector workers. So, we need to pay a fair wage. We need to make sure that they feel supported and respected and acknowledged for the great work they do. And yeah, people are I believe that people are genuinely interested, by and large, in serving others. And healthcare and the education, other public sector roles attract people that are genuinely interested in serving others. And they should be respected and rewarded for the great work they do.